In today's health alert, the CDC is warning the public of an increased risk of dengue virus infections in the United States. An unusually high number of cases have been reported so far, and the agency noted that these numbers are likely to continue increasing as global temperatures rise. So for more on this, our chief health editor, Dr. Partha Nandi, flying in breathless. You are our health hero, sir.
Oh, thank you.
What are we talking about with this virus?
Yeah, it's important, right? So dengue fever, there's been 2,241 cases of dengue fever reported across the U.S. between January and June 24th of this year. Puerto Rico is facing the worst impact from dengue fever with 1,498 cases occurring in the U.S. territory alone. Traditionally, there have been about 745 cases identified in U.S. travelers. For comparison, just over 3,000 dengue cases were reported in the U.S. and its territories last year in 23. Now, dengue fever, what is it, right? It's an illness spread by the bite of the mosquitoes infected with one of four different but closely related dengue virus types. It's most often found in tropical and subtropical climates. However, you have sporadic cases of small outbreaks of locally transmitted cases have also occurred in the states with warmer climates, such as Florida, Texas, Hawaii, Arizona, and California. The reason the numbers are rising is mostly due to increasing global temperatures, which provide a perfect breeding condition for mosquitoes that carry this disease, Glenda.
All right. You all right, Doc?
I'm good.
Take a breath.
I don't have dengue fever.
All right, that's good, because there are some symptoms out there we need to look forward to, because some people have never heard of this, and if there's any treatment or any way we can protect ourselves.
Yeah, important questions, right? So about 1 in 4 people infected with dengue will experience symptoms ranging from mild to severe. Most common symptoms is high fever, along with the following: nausea, vomiting, rash, intense pain behind the eyes, and muscle, bone, and joint pain. There's no specific treatment for dengue fever other than supportive care, like IV fluids and rest. Now, pain can be treated with acetaminophen, just Tylenol. Most people recover within a week. However, severe disease can happen, develops in 1 in 20 folks with symptoms. To protect yourself from dengue, please take preventative measures against mosquito bites. Also, I'd like to mention that there's dengue vaccine available in the U.S. However, it's only recommended for use in children aged 9 through 16 who've had a confirmed previous infection and live in areas where the virus is common. If you're planning on international travel, right, a lot of people are going outside to areas with dengue transmission, do your best to protect yourself from mosquito bites. That's critical. And if you develop a fever or symptoms of dengue, please see a physician, a doctor, for testing and medical advice as soon as possible. You know, it's surprising we're talking about this, but you know, things are changing and climates are changing, so it's important to stay abreast of this. Again, there's a lot of information out there. So if you missed some of the things I said, go to WXYZ.com/Dr. Nandi.
Yeah, and you got to add your repellent to that mix.
100%.
Keep yourself safe. Thank you, Doc.
Hey, my pleasure. Thank you.
Thank you. And this week on the Dr. Nandi Show, death, a natural part of life that we all must face, yet many fear discussing it. Tune in as Dr. Nandi and his guests explore how to find light in the dark. That's this Saturday at 1 p.m.